Welcome to Mental Health Momentum, a Silicon Slopes podcast. I'm Dr. David Morgan. I'm a licensed psychologist and the Director of Mental Health Awareness here at Silicon Slopes. And on this podcast, we talk about mental health issues in business and beyond and look for solutions. And I will introduce my guest to you today. This is Brianne Wolfgramm-Hardy. Did I get that pronounced correctly?
You did.
Excellent. Thank you for being here. Brianne is the Director of Community and Business Development at Aspen Grove Behavioral Hospital in Orem, Utah, with over 20 years experience in the mental health field. Throughout her career, from direct patient care work to leading statewide community outreach initiatives, Brianne has remained deeply committed to improving systems that connect individuals and families to mental health levels of care. Driven by a passion for breaking down barriers to access, she focuses on building strong, sustainable partnerships across providers and community professionals. Her work includes hosting professional education events, leading suicide prevention efforts, and shaping collaborative strategies that expand mental health resources for individuals and families and families in crisis. Brianne is an active member of several mental health coalitions and community provider groups across Utah, where she works to destigmatize mental illness and promote early intervention. Her approach combines heart and strategy with a clear goal to create a more equitable, responsive, and connected mental health community across Utah. That's an excellent goal. I love that. Thank you, Brianne. Thanks for coming here today.
Thank you for having me.
I was talking just a little before the podcast how we get all sorts of different guests on the podcast, and periodically we'll have people that are specific to the mental health field. So this is great. I said we'll talk shop. We'll talk mental health here. So, well, tell me then about your own experience. How did you get into the mental health field? Was there, like, I got into it because I thought I was a little crazy myself. And so that's where I ended up.
Right.
How about you?
You know, I started in the industry when I was 21 years old. There was no plans of this being my career path in any way. And I really fell in love with it. It was an adolescent residential treatment facility. And seeing those adolescents really grow and heal, it changes you. And so I was there for about 8 years and then did a big leap over to business development.
Okay.
And did national marketing with Utah always as one of my territories. And really looking at it, seeing the breakdown in the system and seeing the gaps in services and the lack of access to care, it's heartbreaking.
Yeah.
And once you actually see the suffering that comes from that, you can't look away.
Yeah.
You're part of the solution at that point. And then looking at mental health, it's a spectrum.
Yeah.
Right? So even my own anxiety, perfectionism, grief, we all go through that. And that's the human experience. And so really, we are all part of the solution.
When we talked about that, those gaps that we see, and it's interesting because of all the, terrible things that happen in society, and mental health often gets blamed for those things. But then what do we do? Right? Yeah, we talk about it, but we don't do things to adequately fund it or whatever's needed. And money's not the answer. I mean, it's part of the answer, but it's not the entire answer. But there's stuff that we have to do to address this. It's not getting better.
No.
At least the way that we're addressing it systemically isn't getting much better. I think people are getting better. We talked about stigma and how reducing stigma goes to great lengths to help people at least get help for themselves and for their loved ones. But from a systemic point of view, I think it's still a challenge.
Oh, definitely. Yeah. But I do think the more we actually message it for what it is, it is a mental health spectrum. All of us are on there.
Yeah, exactly.
Right? Depending on our life experiences or situational. And so really looking at that, it takes away the shame.
Right, exactly.
Right? And we need leaders to actually step up and be vulnerable and share that.
Well, who's ashamed of getting a cold?
Right.
Right. No one's ashamed of getting a cold. It's a pain because, you might be down for a couple days or a little less effective or something, but you don't feel guilty about it. You don't feel broken. No. You just think this is part of the physical health spectrum, the physical health experience. That sometimes I'm sick, sometimes I'm not sick. And then when we get really sick, we go talk to people and we don't feel bad about it.
Right.
I don't have this chronic lower back pain. I don't feel bad about going to a physical therapist and say, oh, I'm really sorry. I should have been able to fix this myself.
Exactly.
I just say, teach me. And so she shows me exercises and helps me understand. But with mental health, it's so different. Any thoughts on why it's different? Why do you think?
Oh, so many. I had an experience. My youngest son, he was 1 year old at the time. There was an accident with a ladder, fell on him and broke his femur. Taking him to the hospital, to the ER, transferring up to, another ER or another hospital
Right.
to get the services we need. I had been up in that emergency room so many times just for work, but it was so busy that day. And there weren't enough rooms for all of the families. And looking down the hall, I could see which ones were the ones that the parents there with their child that were having some behavioral issues. And my heart honestly dropped because thinking I can call or text friends, family, neighbors, and get the support I need.
Right.
That mother, she doesn't. She doesn't get to. She has to do this in isolation because it just doesn't affect her child or her, but the whole family. And so she will do that in silence. And if anything, that was awareness to me to be like, I need to be part of this,
Right.
part of the solution in this. It's time to break the stigma.
And like you said, even just talking about it and people sharing their own
Yes.
experiences, especially I think when high achievers share their experiences
Right.
with mental health, I think it's huge because
Yes.
people, they see that. I wish we could have this giant meeting of everyone in the world all at once. And like collectively, we just all kind of drop our pretenses
Right.
and drop our masks and all these things that we put on to look great to others.
Yes.
And I think the sigh of relief would be heard around the world, and we would just go, oh,
Right.
I feel so much better now that I know that so-and-so who I've idolized my entire life struggles with these sorts of things that I struggle with.
Yeah.
Yeah, it's hard for us to do though. It's hard for
So
us
hard.
to,
And
yeah.
but that is real connection,
Yes.
right?
Yes.
If connection is prevention, that is true connection.
Yeah. I had an experience years ago. I was interviewing a woman who had just had chronic issues with substance use and gone through periods of sobriety and periods of relapse. And it looked like she was probably finally in a good place. She had had the longest stretch of sobriety as she'd ever had before.
Yeah.
And she was talking about her daughter. She had lost custody of her daughter several years back for the reasons, the substance use reasons. And she was hoping she might be able to get back into her daughter's life now that she was figuring out how to live her life effectively. And she said, I'm just so ashamed because I'm just such a bad example to my daughter. And I said, on the contrary, I think you're going to be an amazing example to your daughter because when she starts struggling with things,
Right.
instead of saying, well, I don't know who to relate to, she's like, well, my mom struggled with things too, right?
Exactly.
And she overcame those things. And you're going to become the most trusted advisor to her of someone. And so I think that that's the other fallacy is that we have to look perfect to others to be a great example. That's the worst example you can
Right.
give.
It's either perfect or nothing, right?
Or completely, we're so dichotomous.
We're
Yeah.
broken other than that if we're not perfect, which is not obtainable,
No.
right?
And we're never perfectly broken either.
Never.
Exactly.
Never. And there's a gift in all of it. Going through my own anxiety, going through my own grief, my own perfectionism. The gift is I have so much more compassion and
Yes.
empathy. And that's the key right there. And so then you take that compassion and empathy and you be part of the solution.
Right. I love that. Excellent. So tell me about Aspen Behavioral Hospital. So what do you guys do? What populations do you serve?
So we are at the mouth of Provo Canyon in Orem. And we serve, we have inpatient and outpatient services. So our inpatient, we have specialty programs. We have a women's inpatient specialty. We have an adolescent girls specialty unit, adolescent boys specialty unit. We serve adults and we have also adult medical detox. So we have 80 beds. And truly, it's pretty amazing when you look at specialty services. Instead of just doing general mental health,
Right.
you actually use more specific interventions.
Oh, your programming
right?
can be much more dialed
Right.
in. Yeah.
And that's a really awesome thing. And then we have the whole continuum of care for women. So we have inpatient, we have PHP, we have IOP.
Okay.
And then we have outpatient services as well for like adolescents and adults. But it's pretty cool, especially we are a standalone psychiatric hospital, which there's not a lot here in Utah,
No.
but it's really that specialty piece. So
Nice. And for people that don't know, PHP means partial
I know,
hospitalization
right?
program, and IOP means intensive outpatient.
Yes.
Those are just different levels of care. Everything
Exactly.
from being there 24/7 to being there maybe
Right.
several times a week to being there maybe just once a week or something.
Right. Just
Yeah,
the level of
exactly.
support to
Right.
help individuals that need support, in their own daily lives. And who doesn't need more support?
Exactly. Yeah. And what the support we need varies as well.
Exactly.
I love the specialization piece that we were talking earlier, that when I started my career in psychology, I worked in a psychiatric hospital
Yeah.
for about 2.5 years doing my residency, but it was general.
Mhm.
And so we would have people in there, mixed genders, and then some people who were, detoxing off of opiates, and other
Yeah.
people who had been picked up, running naked down the road in a
Right.
manic phase of bipolar disorder. And it was difficult to run groups and things like that because you had such a wide variety of conditions.
Exactly.
So that's amazing.
Yeah.
That you have that specialization. I think that's great. Let's talk a little bit about suicide awareness. So one of the reasons, it's not all the time, but I would imagine that probably at least half the time, one of the reasons people end up in inpatient services is because of self-harm.
Yeah.
Feeling suicidal,
Yes.
having attempted suicide or something. So what can we do as a society? I mean, it's wonderful that you all are there, but wouldn't it be lovely if no one ever had to go there?
Oh, definitely.
If you had to go find a job somewhere else because you guys closed down.
That is the goal.
Right.
That is the goal.
Right.
But if people do need those services, we're there.
Of course.
Right.
So what can we do to increase awareness around suicidal thinking, that people are afraid to talk about it?
Right.
They're afraid if they ask questions about it, that it's going to put thoughts in people's heads. What kind of thoughts do you have on that?
That's interesting because I view it as we have a community responsibility. This is not just mental health professionals. This is families.
Mm-hmm.
This is religious organizations. This is businesses, schools. This is medical professionals as well as mental health professionals. We all have to come together. We are just a part of a piece of the puzzle of the solution, right? An interesting interaction I had is with a mother, and she made the comment that it was very hard for her. Suicide awareness, suicide prevention, anything about that was really heavy for her, and she was worried how that was going to impact her children as well. Truly, like digging into it more, becoming curious.
Yeah.
Why do you feel this way? And recognizing it really was impacting her. And so I asked, would a different messaging help? What if I said a low will to live? And she said, that feels so much lighter to me.
Yeah.
And I said, okay, let's talk about that. We had a great conversation. She was even able to identify how she has felt that in her life, and so much more empathy that she had for people that went through that. And so that's a perfect example of, we may have to change that messaging.
Right. Get more
We may
sophisticated
have to
with it. Yeah.
meet people where they're at,
Yeah.
because it is heavy. And so even just a little bit different messaging can make all the difference.
Well, and I loved what you were saying earlier about how it's a community responsibility, right? And I agree with that. The challenge then is having that community get properly educated on these things, right?
Yes.
Because if we do all have the responsibility, but if we don't know what we're doing or don't know what to say or have incorrect information about it, then that's a challenge as well. And so I think we probably need to do a better job of kind of getting the water to the end of the row and saying, okay, this is what people need to know, and then couching it in terms that might be a little more palatable.
Right.
Some people will be fine with the traditional messaging, but some
Right.
people may not be. And so just kind of having almost a menu of things to choose from.
Definitely.
Yeah.
And there's organizations, there's nonprofits, I mean, outreach.
Yeah.
There's so many options for individuals, families, businesses, schools, right?
Yeah, exactly.
But it almost feels a little bit like we want to stay in our own silos a little bit because it's safer. It's a little bit safer to stay in silos. And at this point in Utah, I mean, the demand is higher than ever.
Yeah.
We don't have the luxury of working in silos.
No.
Let's break these down.
Exactly. And it can't be a turf war or things like that,
exactly.
like proprietary stuff.
Right.
I don't know why I thought about this. There's a book called Project Hail Mary. I don't know if you've heard of it.
I haven't.
Anyway, it's basically this catastrophe has happened to the world where the sun is losing power, and they've decided that within about 7 years that the earth will freeze,
Right.
and that everyone on earth will die. And so, but there's one star in the solar system where that's not happening. And so they have to send a crew to that
Oh.
star to figure out what's going on. It's a clever premise. But my point was, everyone in the world started working together. They shared every bit of information they had, right? The Chinese said, okay, you can use our rocket technology, and that,
Right.
and every private business said you can do this, because the crisis was so significant
Right.
that no one was like, well, let's talk payment or something like that, or I want to share my information. And that's kind of where we're at, not that everyone's going to be dead and, in
love
7
that.
years, but we're at a place where we need to say, hey, the issues with suicidal behavior and thoughts are significant, and we can't afford to just, have our own little
It's true.
silos, like you said.
We truly can't afford this.
Yeah, I know.
Yeah.
And when people get impacted by it, unfortunately, that's when it's too late sometimes, is someone will lose a loved one, because for whatever reason, but then, and then they become a devoted part of the cause. But
Right.
wouldn't it be lovely if we could all be devoted to that prior to
There's so
having the
much that can be
tragedy?
done in
Yes.
prevention.
Yeah.
And I think just looking at suicide awareness, that truly we are our brother's keeper.
Yes.
And the more we actually just look around us, there's so many people in need. We don't have to go out our front door too far
No.
to find people that could actually use our help.
Well, and even in your circle of influence, people you know
Exactly.
already, right?
Exactly.
And the contact list on your phone, there's going to be a dozen people on there who could probably
Right.
use your help today. And why not reach out? Why not say,
Exactly.
hey, how you doing? What could I do to help?
Mhm.
And that. Well, what about, so as we're talking about this idea of it's the community responsibility, any thoughts on what businesses can do? Like business leaders, well, for example, you're working at a psychiatric hospital, specialty psychiatric hospital.
Yeah.
How do you preserve the mental health of your people there?
Right.
What's the culture of mental health at a mental health facility?
It's hard to keep that culture. And it really is truly like a trauma-informed care culture that you're trying to keep.
Yeah.
Right? And so it's easy burnout. If you don't do self-care,
Yeah.
it can definitely be an easy burnout. But in thinking about businesses, how difficult it is for employees to actually navigate behavioral health services, the top thing
Yeah.
that comes to mind is really businesses need to be a little bit more bold and proactive. The most important thing, in my opinion, that they could do is actually look at the insurance companies that they have benefits with, right? 3 ways they could do that is really, number 1, ensure that they're actually following parity law.
That's right. Yeah.
Number 2 is demand transparency. What does the
From
policy?
their provider.
Yes.
Yeah.
What does their policy provide for their employees? And are they going to be transparent on how to navigate access to
Yeah.
care? Right? And the third one is really looking at the opportunity of more collaboration with the member services. I had an experience where I actually had to call my insurance company, and I asked for a whole list of what behavioral health services were covered. And it's interesting, they did not know what levels of care were. Some of the providers they gave me were not still in service.
Mhm.
And I still haven't received that list of all the providers that I was requesting. And I think that's awareness enough. Your employees, it's almost impossible for them to navigate this. If it's hard for me being in the industry for 20 years,
Exactly.
it's impossible for employees to be able to navigate it for themselves and their families.
Right.
And so businesses have honestly a big opportunity right now. They have a little bit more control
Right.
to
Like
be
more
able.
leverage. Yeah.
Mhm. And that's exciting to me because we could actually push a little bit of the pendulum back.
Right. And we start to see some change in the way that providers
Definitely.
Behave and
Yeah.
and stuff. You're absolutely right. If it's, it can be very difficult to navigate that, to
Yeah.
kind of find out what kind of help you need. And And just getting to the point of asking for help is hard enough.
Right.
And if after that there's a mini Mount Everest to climb,
Right.
it's impossible. They'll never get there.
Never.
And they'll just suffer with it, and we'll continue to have the same
Yep.
problems we're having.
Yep.
Yeah, I love that. I love that idea of just making that as simple as possible.
Yeah.
And I think you're right. I think businesses can leverage that. I don't know what motivation the insurance companies have to make it as simple as possible. I'd love that they
Right.
would, out of the goodness of their heart, but there's, obviously services that go out as it affects their bottom line.
Right.
And so, but businesses have the responsibility and the opportunity to say, hey, if you're not going to be this way, then we'll go find someone who is.
We have so many options here in Utah.
Exactly.
Mhm.
Exactly.
Yep. So transparency and clarity.
I love that. Let's talk about stigma. So what do we do? How do we decrease mental health stigma?
I think it's twofold. I think the messaging of the mental health spectrum, I think that's a big thing. We need to
Yes.
start talking about it differently. We need to maybe change the messaging, the low will to live, right? Because it's not either you have it or you don't. It's
Right.
not them versus us.
Your will to live could vary on any given day, right?
Exactly.
You're not suicidal or non-suicidal.
Right. And I think the other piece of this is really looking at how do we come together as a community? There's so many great events going on for suicide awareness or mental health awareness,
Mhm.
right? But it's interesting how many people actually show up. And do you have to really be impacted or lose a loved one
Right.
in order to actually show up? Do you have to stay in suffering to actually show up? And that's a hard thing because families are busy.
Yeah.
But I think it's actually coming together. First, it's looking at community professionals. How are we going to come together? Because if we can come together, we can get the community to come,
Right.
right? So this is why schools are so important. These are why businesses are so important. Medical professionals, right? All of us have a piece in this. Looking at a business point of view, if business leadership take it that seriously and they show up, most likely their employees will show up.
Right.
So I think, there's so many different ways we can do it, but I think the first step is just to show up.
I love that. And I love, because that's different than, because I ask this question a lot and it's a different answer, and I love the answer.
Yeah.
Because oftentimes we talk about, well, just us changing messaging or changing focus or that, but you're saying we need to be there. We need to kind of vote with our feet, right?
Exactly.
And say, this is, I'm here. This is important because I'm here supporting this, not just sending an email to 7,000 people. And I love the idea as well of the mental health spectrum. I think that will go a significant way to helping decrease the stigma, because like we were saying earlier, if you can perceive it as physical health,
Right.
and just say it's just a part of my overall health that I experience, as a human being. And some days I'm happier and some days I'm less happy, and that's okay. I'm not mentally ill or mentally sound, right? That we don't just live in either of those two spheres.
Yeah.
It's constantly, it's a whole continuum, and it's moving moment by moment, right?
Exactly.
Moment by moment. Sometimes
Exactly.
you're like, this is great, and then 5 minutes later you get some bad news and you're feeling worse about things, or
Right.
yeah. And so just seeing that it's fluid and that it's manageable, I think that makes a big difference.
Definitely. And I also think we need to, in mental health, we need to actually look at access to care even more so.
Yeah.
Is it truly a trauma-informed care approach to this, right? Or going to the ER, sitting there, an extra bill, how many hours to then be sent home? Is that really trauma-informed?
Right.
And at the same time, what other options do we have? But I think the more we come together and have these hard conversations, I think we'll be able to figure it out.
Yeah.
And so I think the community needs to have a different experience in access to care, not just someone giving them a number saying, you should call them and see if they're in network with your insurance, right? And maybe they have openings.
Right.
But really, and that's sort of my initiative and really push is the warm handoff, the supported transition and care, right? Identifying the level of care, the specialty needed, because it's not all the same, and then in network with their insurance, if at all possible.
Yeah.
And the more we actually identify where individuals need to go to get the services they need, we're going to see different outcomes. They're going to have a different experience. And I think that's actually on us.
Well, if people want to learn more about Aspen Behavioral Hospital, where do they go?
www.Aspen Grove Hospital.
Aspen Grove Hospital.
Yes.
Excellent.
Yep.
Well, Brianne, thank you so much for coming in
Yes.
today, for sharing your expertise and just such great insights as well.
Yeah.
I really appreciate it. Thank you
Thank you
again.
for having me.
And thanks to everyone for listening. Remember that change starts with you, and together we can increase our mental health momentum.